Welcome. I'm Sandy Oster, and I'm a nurse practitioner, and I'm the National Course Director for the Nurse Practitioner Training Program, which is led out of the University of Auckland. And welcome to this webinar on nurse practitioners in New Zealand. Joining me is Michelle Lowe, who's a nurse practitioner in the Infectious Diseases Service at ADHB, who was a nurse practitioner who trained with us and finished last year or the year before, Michelle, last year. And she will be available to answer any questions about what it's like to be in the program. So you'll be able to ask questions in the question and answer response section. If you've got any questions, please feel free to pop them in there. Otherwise, I'm just going to briefly go through some information for you around nurse practitioners in New Zealand. So the first thing that I have up here is actually a PDF that you can find at the Ministry of Health's website. I find this information there probably the easiest if you're looking for overall information about what is a nurse practitioner in New Zealand. What are they able to do? When they work, how do they work? What are the actually acts of parliament that allow nurse practitioners to practice in New Zealand? That information is there. The scope of practice that nurse practitioners have, because it is a new scope of practice beyond that of a registered nurse. And then some things about what they can be funded and subsidized to do, which getting paid is important for all of us. And then there's a section on the requirements for nurse practitioner training in general in New Zealand, but I'll actually update you with the information around the nurse practitioner training program, which include all these, but there's some slight modifications because we've actually been awarded a contract with the Ministry of Health to train nurse practitioners, and there's a bit more funding available for that final year. There are some excellent links here to finding out more about being a nurse practitioner and some examples of nurse practitioners in their work from different articles that have been done. So this is available if you just type in nurse practitioners in New Zealand into a Google search and go to the Ministry of Health's link. That's all really helpful information for people who are wondering about how to be a nurse practitioner. So we'll stop that. Then I have just another bit of information to share with you. And go here. Michelle, are you able to see the
Yes,
slides?
yeah.
Okay, so there's not too much information here, but these slides will be available for people if they've got information. So again, a little bit hard to read, sorry about that, but nurse practitioners are expert nurses who've completed a master's of nursing, and they also have advanced clinical training from experience in their clinical practice. They are registered with the nurse practitioner scope of practice to assess, diagnose, order laboratory and diagnostic testing, develop treatment plans, and prescribe medications. So there's a lot of overlap between the role of a nurse practitioner and a doctor in New Zealand and internationally. The nurse practitioner training program offers the final year of training in the master's program, 60 postgraduate credits, with 500 hours of supervised practice, as well as release time from study days, and a minimum of 10 days in a secondary placement. So you would have mentorship in your area of employment, but also some time outside your area of employment. We offer an academic mentor as well as a clinical supervisor, as well as regular support and visits from your NP academic mentor. And there's also discretionary funding available for cultural and academic support for nurses who need that in the program. We help you to complete your nurse practitioner portfolio and prepare for your nursing council panel interview. So to be able to be eligible for the nurse practitioner training program, you have to meet all the requirements for registration as an NP once you've completed the practicum year. So that means you need to be either in your final year of your master's or complete the practicum year after your master's is complete. You need to have the prerequisite assessment course, pathophysiology course, and pharmacology course. And we have information on the School of Nursing University website around the specific courses in the University of Auckland. And then you need to have 3 years of full-time equivalent experience in the last 5 years in the area of practice that you'll be employed to once you're registered as a nurse practitioner. So nurse practitioners can practice in many areas. There are over half of the nurse practitioners in New Zealand are practicing in primary care, but there are primary care, secondary care, and acute care. So nurse practitioners work in emergency departments and in patient at risk services. A lot of nurse practitioners work in secondary care and specialty areas of practice like diabetes or cardiology, or someone like Michelle who works in infectious diseases. And nurse practitioners also work in aged care and palliative care. So really is about the area of practice as a nurse that you're an expert and developing a nurse practitioner role within that area of practice. That's all I've got for those slides. So perhaps at this stage, Michelle, I wonder if you wouldn't mind, we've got Joe and Kath and Lauren and Valita, if you wouldn't mind just talking a little bit about your nurse practitioner role, maybe a little bit about your journey to nurse practitioner and how you found your first year of practice as a nurse practitioner.
Sure. So my journey to nurse practitioner has been a very long and circuitous one, and I wouldn't recommend that, I have to say. So I started my postgrad in 2003. I was actually just looking back at my university things. 2003 I started that. With an aim, and I was about 40 years old, I think, at the time, far too old, I thought at the time, but look at me, I've come a long way. And I did, at that stage, I decided I'd follow the nurse practitioner pathway, which was a little bit different in that time. And so that if I ever got to the stage that I wanted to be a nurse practitioner, I didn't have to do lots of extra things along the way. So I ended up doing some nurse prescribing, actually. I did my designated prescribing a few years ago because I'd done my master's and I thought, no, I'm not going back to university, that's it. And then I thought, oh, I'm bored now, what will I do? Oh, well, I'll do some designated prescribing, nurse prescribing, because I didn't feel confident to do my nurse practitioner, to be a nurse practitioner, good old imposter syndrome. And so I did the designated nurse prescribing, and for many nurses that would be sufficient, and in many areas of practice that is a good path to follow. But for me, in a specialised area, I felt that it wasn't as useful as I had anticipated. And my mentor at that time said, oh, for goodness sake, just go and finish your nurse practitioner and stop wasting both of our times in this role, because I do a lot of work with people with HIV. In fact, that is my main area of work. And they're very specialised medications that I couldn't prescribe amongst the designated prescribing drugs. So with that in mind, I approached a few nurse practitioners and spoke to them, and they reassured me that yes, I actually did have the ability to be a nurse practitioner. And so I applied for the nurse practitioner training program and completed that last year. And one of the nurse practitioners down in emergency department said to me, you know, I thought I knew a lot, and then I did the training program and I know so much more now. And I think that is a really good summary of the year. It gives you so much more depth to your practice. It is a very hard year. it is a relentless year, actually, with study. Don't plan any big holidays or any much if you go ahead with this year, but it is such a worthwhile year as well. So, and my practice has changed. And your learning doesn't stop when you become a nurse practitioner. In fact, you learn how much you don't know, because you have that much more depth to your knowledge. So yeah. How has my practice changed? I have decided that in my area of practice, a nurse practitioner, because you can forge your own way, that's the beauty of it, and I saw the gap in access. As I work with a regional service, and so there's many people that can't get into Auckland City Hospital from Northland or from Manukau or even from down the road, depending on their lifestyle. And so my goal is to increase access to care for those people. And at the moment, I'm doing some work to try and find out what they think that might look like, what would suit them, whether it's me doing clinics by GPs or doing clinics in other community clinics and things. So, and it's really exciting, and it's opening up new doors to me. So yeah. Is that enough of me?
Oh, that's a great start, Michelle. It really is a journey. It really is learning how much you don't know, as well as learning new information. Because I know we talked about this a lot in class. Nobody knows everything. Even the most senior doctors we work with, nobody knows everything. And the safe nurse practitioner understands what they know and what they don't know,
Yeah.
and then where to find the information that you need. Does anyone have any questions out there in the chat? Please feel free to ask it. The common questions I get when I get emails, because I get lots of emails from people who are interested to be a nurse practitioner, is the study that you do at university supports your development as a nurse practitioner, but it really is a dual process. You're developing your clinical expertise in your area of practice. You're working with your team to find out how a role could be developed where you're working, what would be supported, where's the need. As Michelle said, it often is the case of finding out where are the gaps in your service that a nurse practitioner could really help develop more access or more specialized care for patients in an area of practice, and then finding out whether your team is going to support you to go forward. And that can be a challenge to have to partner with them to find out that information and see. And some people have found their teams really ready and available and supportive, and I would say especially in the last 4 years. I've been in New Zealand. You all can tell that I don't sound Kiwi. So I come from that American place where we've got lots of nurse practitioners. But when I came 11 years ago, there were less than 50 nurse practitioners in New Zealand. Last count, we have 468 now, which is great. And about 3 or 4 years ago, we finally went over that sort of critical mass where now I regularly get queries from employers saying, we'd love a nurse practitioner. Can you find us one? And we always go back and say, really, it's important to grow your own. And we can work with you and your team to develop a nurse who's interested in becoming a nurse practitioner and then progress through the educational pathway as well as developing that expertise. The main thing I tell people is you really need to look around you and understand that as a nurse practitioner, you have to largely function just like the senior doctors in your area of practice. You don't have to know exactly everything that they know because we have different training, but you need to be able to pretty independently see most of the patients who are in your practice and be on the way to developing that skill. If you're on the way to developing that skill and have that support, then the educational pathway helps with building your knowledge and developing you to get ready. Now, the nurse practitioner training program is the last 2 courses in the master's degree. Or, I think, Michelle, you did this, a number of nurses complete um, uh, the training program practicum year after their master's is complete. Yep. They've gone through parts of their education, done other things, and a lot of times people choose just to finish their master's because there's a lot of, you may not be quite ready to be an NP at the end of your master's, but you can always then come back and do that practicum year once your master's is finished, when everything else is aligned. And then we work with you in Nursing Council at the end of the year to develop your portfolio, because there is a portfolio that you need to do, and submit that to the Nursing Council, and the Nursing Council will then schedule a panel interview. Michelle, I wonder if you could tell them about your panel interview.
Oh, yes. I have to say that the course sets you up very well for this panel interview and for your portfolio, actually. All the way through the course, all your assignments and case studies and things are things that you're actually going to put in your portfolio. They're not just extra bits. So the course sets you up very well for that. The panel interview is, we do a mock panel interview as one of your university parts to your academic training, where Sandy and other nurse practitioners are the mock panel. So you have a very good practice run to see where your gaps are, where you might be able to improve. And actually many people found that by the time they reached the Nursing Council panel, that was a lot less stressful than the panel of the tutors and that we'd done. So we were well prepared. There are 3 people in panel, 3 nurse practitioners, one who is the moderator and is basically your person. So if that person makes sure you're ready, they take you into a quiet room and talk to you and talk you through the process so that they're in and answer any of your questions. You can have a support person with you who is not able to say anything but just sits behind you as a support person that can again stop the process at any time if you get nervous or overwhelmed or just need to take a break for a couple of minutes, or if the moderator decides that you could do with a break, that person will then also call a break. So they talk to you, they chat with you, they try and relax you because it's not a relaxing situation, of course, and then you're presented with a scenario where you go and sit in a room, work through the scenario. You've got a set amount of time. From memory, it's 20 minutes, I think, to make notes, look up anything on the web that you need to, and then you go back into the panel and present the scenario, ask your questions, work through a differential diagnosis as if this was your patient sitting in front of you, and answer their questions. And again, you're not expected to know everything. It's about, if you don't know, being safe in your practice, as you would be in your everyday practice, saying, oh, I don't know that, I would go here to look it up, or I'd ask this person, or and then at the end, they tell you, they meet together, you wait in the outside room, and then they come and tell you that you passed. And as I say, the course that I did, the training program, set you up so well for that. There were no surprises by the time you get to panel. You are well sorted and well organised. And I think everybody in our class passed. Would that be right, Sandy?
That's exactly right.
Yeah.
Yeah. No, that's one of the things that we've really worked hard at. 100% of the people who pass the course and are ready have gotten through their panel interview. There's a question from Kath, and I'll just read that out for the rest of you. Do you have to be in the practice that you will stay as a nurse practitioner? I'm currently in a nurse-led clinic without a GP, so I'm not sure. Kath, there's a couple things there. You don't have to stay. Once you're a nurse practitioner, you can be employed, whoever would like to employ you, but when you're training and when you're developing your skill, you really need to be in a place where you're going to get mentorship. That's a big part of the preparation. So it's great that you're doing nurse-led clinics. That develops your independence, but to develop your skill, you're going to need to find a situation where you actually have a GP or another nurse practitioner who's really willing to mentor you, so that when you start seeing a broader range of patients, there's someone to go present that patient to who can challenge your thinking, to ask back questions of you, to get you to be thinking more broadly and widely about that clinical situation. And that's really the most important part of that practicum and developing that knowledge. So you certainly can stay employed in that clinic where you are now if that works best for you, but you're going to need to find a GP or a nurse practitioner who's willing to give you a day or two a week to work alongside them to help your practice grow. All right, are there any other questions? There haven't been tons. For those of you who are out there, if you Google Nurse Practitioner Training Program, University of Auckland, it'll actually take you now to the webpage that has the information about the Nurse Practitioner Training Program, including the application. And you're all welcome to email postgraduate nursing at auckland.ac.nz. And I'm going to just type a reply here to Cass' question with that email address. And when you email that address, you'll get one of our postgrad advisors. It's really helpful when you send an email and an inquiry that you provide your student ID if you studied at the University of Auckland, and just tell us a little bit about what area of practice you're in and what your interests are in study and where you are a bit on your journey. That just helps us to provide you with the most accurate, best advice and fully answer your question. Good. Any other? Is there any one thing you tell people who are interested in pursuing NP, Michelle?
It's worthwhile. I was
Yep.
just thinking, of all the postgrad studies I've done, this has been the hardest. You know, I've done a master's thesis. This has been it was the hardest year. But I have friends for life with the rest of our class, and our class went from a nurse who worked in Stewart Island to Northland, and it gives you a great, wide, vast network, a very supportive now all nurse practitioners. It was great. And the other thing is, it's one of the only steps that you get monetary gain from. Which is important, I think, when you put all that postgrad stuff, and some places may have monetary gain, but until I became a nurse practitioner, my nurse specialist rate didn't increase. Make sure you have a supportive team, because it's a battle. You know, it's a hard year. It's a worthwhile year, but have a supportive team and get a study buddy, actually, because get one person that you can say, oh my God, what am I doing? I can't do this, because you'll feel like that for many days and many weeks, and they'll go, I feel exactly the same way. So it's just nice to reflect, and you'll just learn so much. It's fantastic.
Great. Thanks so much, Michelle.
Pleasure.
Yep. I don't see any other questions, so I believe, Liz, that we'll go ahead and end the webinar now. I'm not positive, but I think this recording will be available on the university website if there are other people who have questions. So thanks to everyone who's attended, and look forward to meeting you sometime along your journey to NP.
Good luck.